This is called the Swiss cheese model of medical errors. And of course, as you know, in Swiss cheese, there are various holes in the cheese. In order to have a medical error in general, you have to have something that lines up with each hole, and you can prevent it by using various steps along the way. So you can see here cleaning, which actually removes 2 to 4 logs of organisms. We've shown this with my colleague Bill Rotella repeatedly in lab-controlled experiments and in real life. Then you use a second method after cleaning of disinfection, which achieves a 4 to 6 log reduction, high-level disinfection here for ultraviolet light, a 5 log reduction. And then by adding a probe cover before you use it on the next patient, you get a 2 log reduction of contamination of the probe. Again, not complete safety, but some reduction. So if you add all of those up, you end up with your total log reductions here, which is, you can see, would be for this model, would be 9 log reduction, which is substantially higher than any possible contamination on a probe. And here we're talking specifically about HPV. Again, 3 steps to reduce contamination risk. UVC radiation is an effective disinfection method to inactivate human papillomavirus there. So it's really UVC irradiation, and you can see here that as with actually all microbes, they are all susceptible to UVC, although it depends on duration and energy levels for how long it requires to disinfect some different microbes there. As we've noted earlier, HPV will be more difficult to kill than an enveloped virus, but you can see here that UVC radiation is very, very successful. And here they were using the automated antigermics there, and this device showed efficacy against the HPV 16 and 18 types. These are 2 of the most crucial types, most frequent as well, because these are the types of HPV associated with cervical and vaginal cancer. Notice that OPA in these studies showed minimal efficacy. So these results from this study suggested that healthcare facilities using endocavity ultrasound probes need to strongly consider disinfection methods that have been demonstrated to be effective against HPV. Again, 3 steps to reduce contamination risk. You can see, of course, on the left, 0 logs give you no % reduction. Once you get into the green, 7 to 9 logs, you're talking about tremendous reductions there of 99.9999% inactivation there. And so if you started with 1 million HPV, by the time you reach 7 logs, you've completely eliminated all the HPV. And then you can see here what type of kill levels you get with low-level disinfection plus a commercial cover, condom cover, compared to UVC plus commercial cover or a condom cover, and the enormous log reductions and safety factors that you have with use of a method such as ultraviolet light compared to low-level disinfection. Keep in mind that, of course, patients who would be infected with HPV, you're almost certainly never going to know about. This is a hidden epidemic because they won't be picked up for months or years until somebody does a test for HPV, or they would develop a cancer that was HPV related. Again, steps to reduce contamination for HPV, cleaning, low-level disinfection, and probe cover. You can see here that you have only 99.9% removal at best. And so if you have enough patients, clearly there are going to be patients in whom this method will lead to contamination and infection. Whereas on the right, if you use a high-level disinfection, such as with ultraviolet light, you're adding cleaning 2 logs, which is really 2 to 4 logs in many cases, disinfection 5 to 7 logs, and then additional protection with a probe cover, which really gives you a 0 risk for the patient.